So I use the Inliant clinical system to help me place dental implants without the use of a static stent. How it works is I scan a patient using a CBCT scan with either a lab fabricated stent like this one, or just something I make in the office with, for example, Triad, or any material that you can attach to rigid teeth that is non-movable. This is just an example of one of the stents I use with something called a fiducial, which is this little plastic portion that is inserted into the stent. And then the patient wears this stent for a CBCT scan, and the fiducial shows up in the CBCT scan. I then take this information to digitally plan the case on the Inliant clinical system. Then when the patient is ready for surgery, they wear this stent with the fiducial, into which I attach this set of markers. And this set of markers is captured by a camera that's attached to my light. And what I really like about this system is there's no cart or additional hardware that's in the operatory. It's very clean and streamlined, and so there's really nothing in the way of typical drilling protocols. So the patient wears the fiducial stent in the mouth during the implant surgery, and the other part of the system is a handpiece with markers on it that are also captured by the camera that's attached to the light. And so during the implant placement procedure, I have the ability to capture the exact position of my drill relative to the patient in 3 dimensions, which I can actually see on the screen behind me right here. In addition, being able to pre-plan the surgery allows me to understand and visualize whether I'm able to follow the plan using the software. And so being able to have this in the patient's mouth, it's extremely non-invasive, and it doesn't get in the way of my ability to visualize the actual surgical site, which is one thing that I found was a drawback with using a static surgical guide, where the stent would actually cover the osteotomy site. The other thing I like about the handpiece is the only change to the handpiece is there are these little markers on it that are captured by the overhead camera, but they really don't interfere with either the weighting of the handpiece, sterilization of the handpiece, or anything else. It really is just a normal everyday implant handpiece. So here's an example of a patient I've treated using the Inliant clinical navigational system. In this case, the patient was missing a lower right molar tooth, and you can appreciate that the inferior alveolar nerve is in very close proximity to where I would want to ideally place the implant. And so I use the Inliant clinical navigational system in order to help me place the implant safely for the patient. So this is what the patient looked like intraoperatively. You can see that there is a narrow ridge in the first molar region, although we had some good keratinized tissue, which is an advantage. And so from a soft tissue perspective, it was a relatively simple case, but from a surgical perspective, there were some challenges in terms of the bone volume and quantity. And so I used the Inliant clinical navigational system, and here is just a clinical photograph I took intraoperatively, and you can see this fiducial is within the view, but it's not impeding my ability to actually work intraoperatively in the patient's mouth. And so it's very unobtrusive, and it allowed me, though, to very accurately and safely drill an osteotomy and size it appropriately so that it was safe for the patient in this challenging situation. And so here is the final radiograph of this patient, and the inferior alveolar nerve pictured here is far away from the planned implant. You can appreciate that the implant placed is parallel to the adjacent tooth and will allow for a proper emergence profile restoratively. And this case took less time than I would normally take to place an implant, but it is, in my opinion, extremely accurate and well positioned. And so it was a very, very simple procedure to use the system and to get very good results and outcomes, in addition to improving my efficiency and patient safety. So in this case, the patient's inferior alveolar nerve was in very close proximity to the location that I wished to place the implant. As part of the fiducial stent that I used to scan the patient for their CBCT scan, I actually included a radiopaque restorative marker that mimicked the restoration in the area that I wanted. This made it very simple to plan not only the location of the implant from a bone perspective, but to allow for restoratively driven implant placement. So I can tell here what direction I wish to have the implant in order to have the implant emerging in the correct axis of the restoration, in addition to allowing me to place the implant in a location where the nerve would be far enough away from the implant so as not to cause any paresthesia. And you can drag a ruler down in order to measure this distance and rotate the implant again for maximum ideal placement. I then brought the plan to the patient's mouth, where the patient would sit and I would apply the fiducial with the tracker and then use my handpiece with the tracker, and the system, including the camera lights above me, would allow me to actually execute the planned treatment, and I could see that on the monitors directly behind me in real time with three-dimensional viewing capabilities.